Hi, my name is George Pranza, and today I'm going to be talking to you guys about virtual reality and its medical benefits. Before we get into everything you see on the PowerPoint, virtual reality is fairly new to everyone and has many different possibilities, and the ceiling is endless. We're going to get into virtual reality's history, virtual reality's pain, like its use in pain management, virtual reality's use in physical therapy, virtual reality's use in mental health, and virtual reality's use in educational purposes. Now I'm going to talk to you guys about virtual reality's history, and this isn't all of it, it's like a summary. So first, in 1938 came the first stereoscope. It was invented. It was a twin mirror. It used a twin mirror to view a single image. Then you fast forward a couple centuries, and in 1956, the sensorama was created by Morton Heilig. The sensorama simulated an environment and was multisensory. An example of this, if you guys have been to Disney's Animal Kingdom, would be the Avatar simulation ride, where it takes you on a ride on one of the animals from the movie, and you feel it breathing. You get a smell of the flowers as you ride through the world in Avatar. From 1970 to 1980s, a lot of inventors were making advancements in optical and haptic devices to move around in the virtual world. These inventions planted the seed that would eventually sprout in the 1980s when Jaron Lanier created the necessary technology to experience virtual reality, such as goggles and gloves. Thanks to all these inventions and its creators, the advancements in technology, we now are able to use virtual reality seamlessly and for our health benefits. Here we have a couple pictures of these inventions. The one all the way bottom left is the stereoscope. There you see right in the middle where you would put your eyes and you'd look through, and those mirrors would reflect and show the images to the left and to the right. In the middle we have the sensorama. You jump in there, and one of the first simulations that they would use were it would simulate you being on a motorcycle riding down the highway. And then all the way to the right was when we eventually got to more advanced virtual reality. They're the goggles and gloves where you can move around a little more freely and a little more immersed. In recent years, virtual reality has been used in the medical field for pain management and physical therapy, amongst several other things. When the patients are immersed in virtual reality, the somatosensory cortex of the brain focuses on what the patient's looking and not the pain that they're going through. Sometimes the virtual reality immersion could be so well that it could even be used through medical procedures such as surgeries and distract the patients from the pain. A good example of virtual reality helping people manage their pain are patients who have recently undergone an amputation procedure. They go through great amounts of pain where the limb was removed. A lot more common methods to relieve this pain have shown not to be enough for amputees. Conventional methods such as painkillers and some other stuff of that sort sometimes aren't enough for the amputees, so the doctors use virtual mirror therapy, which involves a VR headset and controlling a virtual version of the absent limb. It helps the patients cope better with this phantom pain, therefore helping the amputees cope better with their recently lost limbs and forget about the pain and essentially be a little happier. Sometimes a lot of us could be very lazy and not want to get up and go to the gym, uh, go for a walk, do some jumping jacks, or some push-ups just to get a sweat going, because it's painful and it's not too fun. You really got to have some motivation. Well, with VR, you could do it and have fun, not even notice you're working out. With games such as Population 1, where it's a BR, you drop in, pretend you're in a battlefield, but it's fun and animated, and you're running through there. Or you could just have some fun on Beat Saber, which is you pick your song and you gotta go to the beat as you hit these boxes. So getting up and playing these games at least 1 hour a day, or 1 hour every other day, is gonna significantly help your lifestyle and your health. A lot of people have said that with exercise, their productivity increases. Not only does this help people, is gonna help people exercise, but it also helps people going through physical therapy. Instead of doing some boring exercises of just kicking a ball or something, they can immerse themselves in a game and forget that they just gone through an injury, and just have fun as they recover and get their mobility back in their knee, ankle, or whatever the case may be. I honestly think virtual reality will become a very vital part of physical therapy, and will help patients improve their daily physical activities by incorporating a source of entertainment during their training, and will decrease obesity in USA if everyone gets a VR set and just starts getting a little more active and just having fun. Another very important thing that VR is going to help with, or is already helping people with, is mental health. Studies in recent years have shown that virtual reality has had a successful impact on PTSD behavioral treatments. PTSD affects 3.6% of the US adult population. The distinct symptoms of PTSD include anxiety, flashbacks, nightmares, and altered perception. Exposure therapy helps reduce or eliminate these symptoms, and VR is believed to be a valuable adjunct to the treatment. Patients with anxiety disorders also benefit from virtual reality exposure therapy in several ways. This form of therapy allows the VR to expose the patient to certain scenarios, which could create a sense of comfort and help them overcome their fears or phobias. It may also help with depression, in the same sense that you can distract yourself with a game, or put yourself in a nice calm sunflower field in an instant. Virtual reality has become a very important thing when it comes to educating in the health and medical industry, and in the military. Doctors and nurses have been trained through education of virtual reality, and are being prepared for their future careers through simulation. They're able to practice surgeries and other procedures that they can't do on the daily because they're not certified yet. And instead of just standing there and watching someone, it's hands-on and they're able to do it themselves. Same with military training, such as practicing flying a helicopter. You don't want to just throw someone on a helicopter that doesn't know how to fly a helicopter, because that costs money and many people could get hurt. So this allows that simulation, and that they keep it very, the simulations are able to be very realistic, and you'll avoid risk and allow multiple times of practice without no injury or cost. Thank you for watching my presentation on virtual reality, and I hope that I have educated you a bit more on it.